Great. Okay, thank you very much. Really thankful to Professor Hamad for this invitation. And I thought research is something which we are not much involved if we compare to other countries. And this is something I think we need to keep reminding ourselves as a clinician and also especially to our trainees how we need to do the research and what are the steps we need to take in everyday life, in every clinical practice, which can help us to build our research portfolio. So in the next 25 to 30 minutes, my aim is to cover why we need to do the research, what are the importance as a clinician. Some of the points were highlighted by Professor Hamada already, but I will just reinstate those because these are very important points. Then we need to have some overview of what are the basic concepts in a clinical research, which a clinician can do easily, and what are the pathway we need to take with the research cycle, which I already mentioned, what are the steps of that research cycle. And in the end, like I will just give you a few tips like which you can start doing from now, which will be help you to start your journey as a researcher in a clinical practice. So if you ask yourself like why we have to do research, why bother, what is the why we have to be emphasizing the importance of research. So the answer is that like it is not only helpful for you but also helpful for your institutions. If you look at like people who are progressing, they have a very strong research portfolio. And similarly, all the bigger institutions, they are investing heavily in the research, which is going to help them not only to discover new things, not to only achieve academic achievements, but also generate more manpower and also generate more a source of income in terms of funding to carry on more research. So the overall, if you see like the research is a combination of a beneficial effect, not only for the institution, but also for the individual. And if we look at a clinician as an individual, like if we have to progress in our clinical practice, we need to have a good research portfolio. And this is only one aspect to progress, but the most important is that for the clinician personal growth as a clinician and to do a practice in a more confident manner that you know that you are doing the right thing, a sound knowledge of research is required. Even if you're not able to do the research, you should be able to actively critically analyze any research papers so that you can use that data to apply in your clinical practice. So the main goal is that it will promote your growth and also growth of the institution where you work. And if you have to progress, this is an essential step in this era. So when I look like what kind of research as a clinician we can do, we divide it into two broad categories. One is primary medical research, which is based on either your research is involving basic or laboratory investigations. You have epidemiological or clinical practice. So these are the like three cores part of the primary research, and each of these domain has a further classification like basic research as applied and theoretical, and intervention and observation studies are a part of epidemiological or clinical practice. Then we come to a second phase, like one is this primary medical research, then we go to a second phase, which is the secondary research, which involve the data which was collected from the primary research to implement and get refined data from those primary research to apply into review articles like systematic review, narrative review, or meta-analysis. So although all the clinical data is collected initially as a primary research, but this can be recollected and analyzed in a secondary research. So this is one paper. I think I have put a PubMed ID and DOI of this paper. This is a very nice paper written by Grimses and published in Lancet in 2002. This is not a very big paper. It's about 2 to 3 pages, but it has given a very nice review of what are the types of studies. Often as a physician, we don't read what are the different type of studies. We just learn as we progress in our career. But this paper has given a very nice introduction of what are the different types of studies, what is the meaning of cohort study, what is the meaning of case control study and cross-sectional study, and similarly randomized and non-randomized trial, and various other studies. So I will strongly encourage all the residents, just maybe take a screenshot of this slide and read this paper to get a basic understanding of the different type of clinical studies. So if we talk about the evidence, like we know that this is a pyramid which is showing how strong is the evidence on the basis of research. If you look like on the top, we have secondary research, which is the meta-analysis and systematic review. But the core of this top is made by the primary research, which is basically unfiltered data we gather from case control studies or cohort studies and randomized trial. And that data is then compiled together and critically analyzed to present in terms of systematic review or meta-analysis, which give us the strongest evidence. So this pyramid need to be remembered when you're starting your research products, you should know which part of this pyramid you fall in so that you know the strength of your study. So now where to start? Like this is a very important question. Like most of the clinician, when we think about research, we always think it is very complex procedure. We don't know where to start, how to progress, and how to end our research project. And especially if I talk to surgeons, many, not only urology, but other specialty, we can see a lot of excuses from the people. The common excuse is that they don't have time, they are very busy. If they're doing surgical training, they say like all they want to do is surgical cutting, they are not interested, they don't want to be scholar in doing the research. And some people are honest enough, they say like they haven't have a training, so they find it very difficult to start the process. However, we need to understand this is not an option. This has to be done. This is simple as that. Like if you want to do a clinical practice, there is no shortcut. If you want to progress, that research has to be done. So what is our job is to how we can make this process a bit more simple and logical so that it is possible for every one of us to do some kind of research and we will be able to analyze the literature as well if we have gone through the normal process. So let's see how we can make this process simple. So we talk about the research cycle. So in clinical practice, there are 5 steps which you need to do to start any research project. So this number 1 is the idea, what topic you are going to do, what is the topic you want to put it to your test, do the research. Then once you get the idea, the next step is that you have to have literature review to get the background knowledge, how much research is already done in this specific topic. So once you have done literature search, you get a more clarity that your idea is worthwhile to proceed or not. Then you will generate your hypothesis and research question. And this next step, which will be step number 4, is that you will put your hypothesis to a study design. And once the study is started, you will collect the data and analysis of data. And ultimately, once your study is completed, your aim should be you will present your data to any scientific meeting and also publish after writing your study result. So this is a cycle of your research in a clinical practice. So now I will talk about one of each step in the next few slides. The first step is the idea. So that is the starting point and often considered as more difficult point. We don't know where to get idea. Despite that, you will see like many publications are emerging every day. So it means that getting ideas should not be that difficult. Millions of publications are published every week, every month. So there has been some process how we can get an ideas. Sometimes you're lucky, you maybe get idea very easily. Sometimes you have to put some effort to get an idea. There are few areas which is around us which can provide us clues to get ideas. The first one is the clinical encounter with the patient. We are seeing patient every day. Some of us see maybe 100 patient every week, 200 patient every week. We review their disease process. We go through their lab result. We see how they're responding to treatment. And every day we are having this encounter. So these can give you an idea when you're seeing this patient. If you start looking to look for some idea, you can get your ideas from here. The second important source is your colleagues. Like when you read any research paper, your colleagues are working on a research paper, you may get a different kind of idea which you can apply to start a new research project after discussing with your colleagues. The most important is that journal articles. If we read journal articles, most of the journal article in their conclusion or discussion, you will read a familiar phrase like further studies are required to evaluate. And that can give you a clue like what can you generate an idea which you can start a research product. So these are three important tools to generate an idea. There are a few other. When you attend any scientific meeting, you will meet your colleagues, you can share your research work with them, you can get a new idea, you can get ideas from posters and presentation. And sometimes you can do reverse engineer of the available data. One example is that if you have a data collection system in your hospital or institution, for example, there is a patient who has TURP done in the between 2000 and 2010. You have all the data available. You can generate an idea from that data that how many percent of these patients has incidental prostate cancer, which was treated or untreated, and what is their survival advantage. So you can use a data which is already available and generate an idea from the available data. So these are the 5 important areas. When you are looking for an idea, look on these 5 areas: your clinical encounter, your colleagues, journals, scientific meeting, and reverse engineering. And you will be able to get an idea from these which you can use for your research project. So what topic to select? That will be next, like which area you want to do research. So if we look at like all the bigger institutions, they work on 3 common principles. So we do a clinical practice, we do some research, and there is always education and training. So these are all 3 areas. We as a clinician are lucky, like we have exposure to all of these. Like we all involve in training, we all do clinical practice, and we all do some research. So even like all of these domains, you can select topic from each of these domain, either from clinical or research work of your institution or educational, and use that to start the new research project. So what you can select from these one, so you can select like systems, how your system is working around you. For example, you have hematuria diagnostic setup in your system. You can, this is a clinical part of which you can get an idea how rapidly you can improve your service and what changes you need to implement. So you can use that as an idea to start your research project. Similarly, in the research, if you're doing some data collection or doing some lab-based research, you can select that system and put that system to test to start a new research project to allow you to have another parallel study going on. Similarly, education and training. If one example is that this course which you are attending now, you can generate an idea from this course, like how this course has been effective. This has been running successfully for last few years. So we can present this data from this course, which will be able to help other institutions to adopt as well. So there are opportunities around us which you can select, but important thing is to try to select the topic which is interest to you. If you have a more interest in clinical practice, select the topic from the clinical practice. If you have more research in education and training, select the topic from that area. If you have more interest, then you will work hard and you will work with more passion, because it is your area of interest. Nowadays, I think you need to pay special attention that things have been changing regarding big data, artificial intelligence, and social media. They can be used as an important research tool, either in clinical practice, research, or education as well. So once you have identified that this is your research idea and you have identified the area of your research, the next step is to go for a literature review. This will allow you to identify what kind of work has been already done, and what you can do differently to add into clinical knowledge. So we all know, I think we don't need to go in detail, like Medline, PubMed, guidelines, and clinical trial or .org. They can give you a good understanding of any research work done on this topic. There will be review articles. So probably it is a good idea, like once you have understand that you're going to start your research project, just go to do literature search to get a background knowledge and see how best you can design your study to get meaningful outcomes. After literature review, when you feel that your idea is worthwhile, then you need to generate a hypothesis and question. The question is very important. That will form the basis of your research project, that what question you're going to ask from this research project. And the first thing is just try to identify whys and how you are going to do this one. So who will be your study population, what disease or exposure risks or factor or outcomes of any treatment you're going to test, where you're going to do this study, and what will be your time period. So these are important things which you need to keep in mind. And remember that it is an evolution. Like once you have a rough idea in your mind, it will evolve. Once you have done the literature search, it will evolve with a period of time. Once you gain more knowledge and once you start thinking how you best formulate your question on the basis of this who, what, where, and when, your idea will mature and it will evolve into an hypothesis. The question is based on your hypothesis. This question is important because this will give you an answer when you put to the test. So there are two basic type of question which you call descriptive, which describe an interesting case or case series, and quantitative when you have two variables to compare and assess the relationship. So these are like broad categories of study questions. The questions should be defined clearly and ask yourself, this should be answerable. If you look at any big study like PROTECT trial or PHOTO trial, there is a specific question they're looking. For example, PROTECT, they want to know which treatment is best for the prostate cancer. PHOTO trial, they want to see whether PDD is helpful to reduce the risk of recurrence of high-risk cancer or not. So the question should be unanswerable. It should not be an open-ended question. The question should allow you to work on, and at the end of the study, you should be able to get answer on that. You need to also think whether it is going to add anything into existing knowledge or it is something unique. And this idea only will come if you have done a good research, literature review before going to the hypothesis generation. Sometimes a result may not be, your question may not be addressing a unique issue, but it can help you to clarify the thing which have been vague in previous literature. So that is also acceptable. Like either you can improve the existing knowledge or you can get more clarity of the existing knowledge from your question. Feasible is very important. Like you cannot select something which is not achievable. Most of the residents, they work in a rotation. So they need to have a set up time frame that they want to finish this in 6 months, 1 year, and this has to be followed very strictly. You should also have aim, like what is a success from this project for you, whether you want to just finish for a presentation poster or you want to go all around to the end, like to publish this paper. So this should be very clear from the start when you're starting your research project. So after the hypothesis generation, the study design. The study design, as I mentioned, that Grimsey's paper in Lancet, there is different kind of studies you can do. The study design will depend what kind of study you want to do. However, basic principles are that you need to have clear aims and endpoints, timeline, data collection should be robust. You should have a team identified which will collect the data. And then you have to have periodic meetings to assess the progress on the project. And finally, once the data is collected, you need to have some expertise, either yourself or you can have statistician to analyze the data. Then subsequently, how you're going to write and publish the data as well. So these are like, they should be made a framework of your study design at the start. Often you have to modify your study halfway if it's not going in the right direction or there is issues during the study. So you should be open to as well that you can adopt if changes are required due to unforeseen circumstances. So data collection is also important. Like there should be people, like you designated people like who will collect the data, and the system of how you are going to revalidate whether data collection was accurate or not. Some of the skills which are required for most of the paper, we can learn as a clinician. We have to be ready to do some statistical course, Excel, expert in Excel, Word document. These are the basic statistics skills which are not too difficult to learn, and many of clinicians can learn them easily. However, if there's a complex statistical analysis required, then you will need help from a statistician, which is not that difficult these days. We can get help easily. For most of the universities have these one, and you can get a private statistician if is required. So what we're going to do with the data, like if you get a data, so data is important source. It will tell you what has been done as a historical background. You can get an assessment of the trends which has been done in the past. You can also forecast what's going to happen in the future, and you can extract some information from the data which can form the basis of your new research project, and it can also sometimes help to discover something which is not already done. So once the data collection is done, these 4 outcomes of the data can guide you how best you're going to write your paper. Is your data giving some information about the historical event, or it is forecasting something to happen in future, or you're going to extract some more study ideas from the data, or sometime it could be a unique and you may get some new discovery from your data. So once we know what you're going to do with the data, these will be the 4 possible outcomes. So writing for the journal is something which...
Sarfraz, I'm sorry to interrupt. I think before you go to the writing process, which is really a totally new subject, and probably one of the main area of difficulty after getting an idea is to pen it down, actually. There is a couple of points that Mr. Munir Ahmed have raised, and I think I need your little input on this before we move on to this section. Is that okay?
Good.
So Mr. Munir writes that a medical practitioner should also seek to develop qualitative research methodology, consider public health questions, educational research, ethical perspective on research, and new and economic methods of care of delivery. All these are plausible ways of doing new research. And any word on this? Because most of the clinicians find it very difficult to do these kind of research, particularly the qualitative analyses.
That's true. I think when I mentioned that what kind of our exposure is that we work in like clinical practice. We can work on the research or teaching and training. And also, like if we look at the type of primary research, epidemiology is the important factor. I totally agree that we should do it. However, what we are focusing, like if we have to find a topic which is interest to us. So for us, like as a clinician, mostly we are attracted toward the clinical research because this is an area where we feel we have a basic knowledge and we found ourselves comfortable. Other research aspects are important, but I think finding interest on those is very limited because we don't practice those things. But I totally agree that need to be done, but I don't know who will be the best person to do, whether it's a clinician or we have to have separate epidemiologists or other people who can work on this.
I think the multidisciplinary research teams are really the one that probably can embark upon that research, unless Mr. Munir have other views on that. The other thing about the qualitative research is that it's quite different from what we do normally in our clinical practice or even bench research, is that there are no defined questions. So it's quite open-ended. Although you have an objective, but you may not have a defined question to answer. Any views on that?
Yeah, I think exactly. I think this all depend what is our training and interest and whether we can do it or not. And my feeling is that multidiscipline is very good idea. I think this is because they need to have a clinical input, and then that's how the MDT or multidisciplinary team will work on that. Open-ended question always pose a difficulty, and that become a little more difficult than a simple, straightforward clinical study, and that may be one reason like people are not going into that commonly as they go to other research. But MDT, multidisciplinary involvement, multiple team from the different domain, that is the way to go for this kind of research.
Thank you very much. I think you can proceed with your presentation.
So I think as you mentioned that the writing for journal is the most important, most tedious part, and at the start of the study, this should be our aim. Like we want to write a research project. It is a separate topic and a separate talk, but I just want to summarize few things. Like what I have adopted, like even you can write introduction and method before starting a research project. Once we have done the literature review after the ideas, that is a time like when you can write the introduction. You can refine it later on, but this is the time I think I will advise you to start writing 1 or 2 paragraph about the introduction, about the specific research you're going to do. And similarly, because you have designed the study, you can write the methodology as well at the same time. Once you have done the 2 part, the third part will become easy because the data collection, you can keep writing as you collect the data. Again, you have to finalize later on, but that is the one step which you make your life a bit easy because you have written already 2 or 3 parts of the paper. Then you will come to discussion, which is the most difficult part, and you can only write discussion once you have complete data available. And the writing of for journal take few months. Like you cannot write like overnight. You have to go through your writing. You need to get information from your mentors and keep writing about this one. So I'll come to that, how you can improve your writing skill in the next few slides. But I think this process can start at the start. Don't wait study to finish. Start writing at the start of your research project, especially introduction and methodology.
So that's a very
To get-
important point raised by Mr. Sarfraz Ahmed, and that journal article appear with an abstract, introduction, methods, results, discussion. However, this is not the way you write in that sequence. An abstract is perhaps the last bit that you write, which is the most difficult thing, is to concise your whole paper into 250 words. And really, introduction and methods, as he mentioned, is the first thing, because method is what you have done. So what you have done is something that you can easily pen down. And introduction is essentially why you have been doing this. And then obviously the results and discussion follow. All right, Mr. Sarfraz?
Correct. So in the discussion, like the discussion is basically you have to give a scientific justification for your results. And how, and there'll be some like result may not be accurate. There may be some flaws in the result, and you just need to justify with a reference like how these result can be justified to get an idea how you can formulate your discussion part of the paper. You need to present your work in a meetings, not only like local meeting, but also present in a international meetings as well. On those meetings, like you will be asked few questions relating to those study questions, and these questions you can get an idea that you need to clarify these questions when you're writing discussion. So when we talk about the cycle of research, it is important to present this work in front of your peers so that you know what are the flaws and what question you need to discuss in the discussion part of the paper. So that's also important, like discuss yours, share your result with your colleagues. Teamwork is very important. You cannot write paper on your own, especially when you're doing residency. You may be able to write later on in your career like review articles, but usually you need to work in a team. You should be having colleagues from your department, other departments as well. If you have if the study is a bit more broader, you can have different institutions as well. And you need to have like one mentor or 2 mentors which can guide you through the process. Reading again is essential for this journal writing. Whenever you write paper, next day you read, you may have to amend few lines as well. Just keep doing before submitting. It is a tedious process, but it becomes enjoyable once you see that your research is published. So how we can start the journey as a resident? I'm talking about the perspective of residents now, how they can start. We are unfortunate, we have no formal training of doing research in most of our curriculum. But we are expected to do the research work because this is the only way if we want to progress as a clinician. The research is just like swimming, like you cannot learn by attending courses, webinars, or reading books, or reading how to do the statistical analysis. You have to jump and start doing this one. This is the only way you will learn. You will make mistakes, but you will learn over a period of time. If we look for the opportunities, like as I said, like we are surrounded by a lot of opportunities. We are seeing many patients every day. As in all the bigger institutions, they have some research infrastructure. You can get ideas from there. And similarly, we are very closely involved in education and training. So these are all opportunities which are there. We just have to grab this opportunity if they come in your way. If these opportunities are not coming in your way and you found that there is no opportunity, then it is not excuse not to do. Then you have to generate your own opportunities. How you can generate these opportunities? the 4 basic principles, like you can reflect on any clinical scenario. For example, you have seen a patient in your clinic which is a unique presentation of a specific disease. So when you go home, you should think like what idea you can generate from this kind of patient, which you can use, observe around you how training structure is working, get an idea from the training if you want to do the research work on the clinical practice. Once you have this kind of observation and reflection, you can try to simulate and see how you can get a bit more information which you can use in your study. And the last one is that you can collaborate with your colleagues and start working. So having no opportunity coming your way is not an excuse. You should work on to generate this opportunity using these 4 principles. So research, if we look at the ingredients, so one is the important thing is that basic knowledge. Like if we are the urologist, if you want to do work on prostate cancer, you should have a good basic knowledge, ability to conceptualize, to help you to generate an idea and generate hypotheses. Team working is very important. You try not to work on any project solo. You should have a team which can help you. Communication is a key. Honesty is important part. Like whenever you are presenting some data, just need to present honestly, not to fake any data. And then you have a commitment to complete your task. Like once you start a project, it will be difficult, it will be frustrating, but need to complete the task. So these are all the juxtaposition you need to have a good research project. The research mentor, I just highlight few things like why research mentor is important. So most of us, like when we start our residency or early years of training, we need to have some mentor who has gone through this process of research, publication. So identify in your department who can be your mentor, because these are the people who will guide you through the process. They will advise you, they can train you if anything required. Coaching can be provided. They can tell you which way to go. You may have thousands of ideas, maybe only one idea works, so they can guide you, which is more practical. They can set a goals for you. They can provide support and motivation when you're down, because there are many times in research when your shoulder will be down, you need someone who can support you and motivate you, and he will enjoy success with you as a mentor. He will be happy to see you successful once you have completed your research project. So a few steps, like this is from my personal experience, like how I found we can be more productive in producing papers and publications. So we used to have like 4 or 5 days during my residency years in a UK hospital. So we started doing a research meeting at 4 weekly intervals. So what was the purpose of that? That all the resident, they have to give one proposal, and there was 2 mentors chairing the session meeting, and they will guide us whether this is to be done or not. And then if it's approved through that meeting, they will do the work on this, and every month we will just keep checking the progress on those projects. A regular journal club is essential. I know many hospital has a journal club, but we need to have everybody need to read that paper, critically analyze the result, and everybody need to be active. So journal will not only give you more ideas, it will help you to how to analyze the data, and also give you an idea how you should write your paper when you reach to writing part of this. So this is absolutely essential, regular journal club. Research mentor, I already mentioned that you need to have a research mentor. Then collaboration, you can do a national. Within your hospital, you can work with a different team, like nephrology, you can work, or laboratory science. You can have an international collaboration as well. And teamwork is a key. Never work solo. If you have 5 residents in your hospital, all 5 should lead on one project, and you should collaborate in the remaining. So by the end of your training, you may have a 5 paper rather than having 1 paper. And one person cannot finish this job. So this has to be a teamwork always. So finally, I'll just summarize, like the key to success as a clinician and a researcher is that you just have to do it. There is no excuse. And as I said, like it's just like swimming, just jump and start doing this one. There will be some disheartening or disappointing results, but don't give up. You will get better and better in research, and one day you will have a publication profile which you are aiming for. Thank you very much. That's all from me.
So thank you very much, Mr. Sarfraz Ahmed. I think it's a very lucid presentation, very clearly. You talked about the principles of why it should be done and also how it should be done. And absolutely correct in saying that there is no better way to learn and is by experience. And there's certain things that you cannot learn from the books and presentations. You have to really experience them, feel them, to be able to understand what it all involves. So it's open now for discussion. If there are any questions to Mr. Sarfraz Ahmed, or if there are any comments, please feel free to use the mic or write it in the chat box. I think there are a lot of junior colleagues as well in this forum, and they probably would be able to ask some questions to clarify certain concepts about research. So we have questions already now. How to choose a journal suitable for publication? That's a very, very good question. This in itself is a whole topic, how to choose a journal. So Sarfraz, and any views on that?
Yeah, you're absolutely right. It is a whole topic. Again, I think we want to have the highest impact factor, but we need to be realistic, like what is the nature of our study and how good is study, and that's how your mentor can guide you which journal we should submit. What I normally do, like try to submit a bit higher impact factor journal. If you are given, if you rejected, you will get a very nice comments from the reviewers, which you can use to submit to other journal. So aim for high, but need to be realistic. Depend upon your study. If you think your study is very strong, definitely go for the higher impact factor journal, international journals. If you think it's just like a case report or case control study, which is not that strong, your mentor can guide you through that process. Then your expectation should be realistic in this regard.
So I think it's a very important point that you need to be realistic. There are certain key points, and that's true that the high class reviews that are available to you if you submit it to a quality journal are really very helpful. And I've personally learned a lot from those views and critique of my paper. It's also important to understand that you need to see, because the review processes and the turnaround time is quite long now. So it may take months really for you to get an answer of what is the outcome of your submission. So it's important that you select your journal appropriately to see if, obviously you'd like to publish it in European Urology, but not every article that we write can go into European Urology. We need to see if European Urology publishes that kind of work. So see what they've been publishing the last 5 years. Also see which journal publishes more of your area of work. And then take an opinion from a colleague who has published previously to see what's real worth. It's difficult to be self-critical. And then maybe opinion from your colleague will be of help in really assessing what is the worth of your paper. Obviously, everyone would like to publish it in European Urology, but it's not easy. So any further questions to Dr. Sarfraz Ahmed? Any comments from any of the colleagues, any of the difficulty that you have faced in your process? So Mazhar Sheikh has raised his hand. Please, Mazhar, go ahead.
Good afternoon. Assalamu alaikum, everyone. It's an honor. I know, Professor, you and Sarfraz for some time, and me and Sarfraz is here few moments in the part of the journey. I won't take too much time. The only thing I would ask the juniors, don't be scared of a failure. And the only thing is you need to believe in that you want to do it. Don't do it because you have to do it because somebody is asked. As clinicians, many of the time, you say, why we have to do this publication? Why have to do research? As Sarfraz and Professor have mentioned, it's a journey. Till you take your first step, you will not learn. All of us, we have gone through challenges while we write it. But good thing is work as a team and be honest, and you will get through. So there it is the pathway as with any journey. but trust in yourself, believe in yourself, and don't be scared of failures. All of us face those at some stage. Thank you very much.
Yeah, I think that's an important point, Mazhar. Thank you for raising this. That this journey is fraught with difficulties. This journey is not easy. And the more early phase in your career, the more are the failures. And if they deter you, you probably will not be able to progress. Why you should be doing it, it's important. And how you learn to do it better right in the beginning is to be involved in what Sarfraz has also mentioned about the journal club. So journal club should be an essential part of most academic teaching units, because once you start critically analyzing a journal article, a published article, you probably would understand that these are the mistakes that one should not do when you are writing a paper. So listening to some of the seasoned researchers in your department, when the journal article is being criticized, irrespective if it is your specialty or some other specialty, but some of these comments are very generic, and learning from that point will give you a lot of understanding of what the reviewers look into what the publishers, what the journal editors look into your article before you start submission process. We still have a few more minutes, so I really appreciate colleagues to make comments, give further input. So, Sarfraz, what has happened? Let me just give you a little background before people can ask further question. Is that our trainees are supposed to write a dissertation, which is really a waste of time, because primarily it goes into an archive where it is not retrievable and you don't get any points. But also that it's not something which is really worth all the effort. So what we have done is move our residents from writing dissertation to writing 2 papers in an index journal. And so even in your residency, when you graduate, you have 2 index paper to your name. And that feel is as important, because some of these residents have gone on to become academic surgeons, and they've been contributing continuously into the research repository. So when should one start? Should it start early? And any views on that?
I think early is the best one. What I found the best years, like in our training system, is probably the residency. But if somebody has an option, even the internship, they should be involved there. I have seen many students from UK and even UAE. They have publication even finishing their medical school because they got the exposure quite early. So early is the better one. When they enter, even the residency is not the bad, because they're now clear that is they're going to be pathway and that's what they want to do. So early years of residency is the best time to start this. And I think this is very important. I totally agree that designation, which was part of FCPS, is not adding any value to the clinician in a research portfolio. It is just become a paper exercise. And this initiative of having at least 2 paper to get your completion, I think this will be very good. And I think even in UK, we have a 2 paper published required before CCST. So I think encourage people active involvement of journal club, input from the mentors. This has to be a continuous process to encourage these young doctors to start the journey very early.
Right. So I don't see any further questions or comments. With this, I thank you, Dr. Sarfraz Ahmed, for this wonderful presentation. And I'm hopeful that we will be able to engage you more in our further conceptual base of urology course sessions. So thank you very much to all the delegates who attended this meeting, and I'm sure that you must have learned a lot from this very lucid presentation. And if anyone is interested in looking at it again, it will soon be available on the PAUS Karachi website and the conceptual base course session. So with this, thank you to our presenter, thank you to our delegates. Have a very good evening and a very good
Thank you.
weekend.
Ali.